Our first speaker is Dr. Emmett Lee Rice, and he's going to be talking about addiction and recovery and giving us some practical information on how to either help ourselves or our family members. He is the CEO and the medical director of Life Wellness Institute here in California, and he does an incredible job talking about addiction, how it works, how people are addicted to different things, and really the practical ways of getting out of it. After his presentation, he's going to be moderated by our moderator, Dr. Mark Moyad, who is with the University of Michigan, and the Q&A is just fantastic. I hope you find this information helpful.
Thank you, Alex. It's a pleasure to be here. I'm happy to talk to you today about this very important topic of understanding addiction. I'm a family physician, and addiction is something that I have come across mainly when I was a team physician for the San Diego Chargers. And we had a fellow who's the NFL drug advisor come in and give us a talk at the NFL team physician meeting one year. And what he told us about addiction and how drugs affect the brain was mind-boggling for all of us. None of us had ever heard that information before. And to me, it was very exciting because it explained not only addiction and why addiction happens and how can we deal with it, it also explained the keys for wellness and what everybody can do to be more well is the same things that people in recovery need to do to stay healthy at all. So this is great information for all of us. I hope you enjoy it. I, having learned about addiction, have dealt a lot with people in recovery. And I will tell you that doing interventions and helping people through the process of recovery is one of the most rewarding things that I do as a family physician. So I'm happy to be here and excited for you to help understand this. Today, what we're going to do is I'm going to give you kind of how I see it. I'm going to tell you what happens, what we see clinically with a patient who's using substances and how their life transforms itself during that process. We're going to talk about how many of us are affected by it. We're going to talk about how drugs affect the brain and why they affect the brain and why the behavior that they employ is so predictable. It's very, very predictable, and you'll understand that in a minute. So first we'll understand and talk about what happens. Then we'll talk about why it happens, and that has to do with brain neurochemistry. We're also going to talk a little bit about how it affects the family, because this is a family disease. We say that families get sick together and families get well together. They recover together. So it's important to understand how this affects the families, and in a work situation, it affects the entire workforce, the workplace. In a team situation, it affects everybody on the team. And so this is something that doesn't affect just one individual. It affects everybody that individual is involved with. We'll talk about the solution. What do you do about it once you understand you have addiction and you need to get treatment? And we'll talk a little bit also, I'll share some information statistically about the recent opioid epidemic that's occurred in the last probably 4 or 5 years, and what that means and how we deal with that. And then at the end of the fact, after our talk, I'll be happy to answer any questions you have, and Dr. Moyad and I can talk together about that. Initially, what's really important to understand is that all drugs that alter brain substances are euphorics. So all drugs, whether they're an upper or a downer, whether it's a Quaalude or a Valium or an amphetamine, all these drugs that people take that make them feel differently that they like initially cause euphoria. And that's sort of a strange thing when you know that, for example, alcohol is a chemical depressant. But initially, when people drink alcohol, they get giddy and they have fun, and you see these kids playing around after using, and it's really clear that they're giddy and funny and having a good time and they're euphoric. So why does that happen? We'll explain that, and we'll explain what happens as you go through the course. So remember that initially, nobody wants to become a drug addict. There's nobody that started using drugs or drinking alcohol that says, you know, I'm going to screw up my life and I'm going to cause myself to be addicted and take away everything that I really value in my life, and that's where I'm going to go. That's not the way it starts. It starts by just wanting to have fun or experimenting. The age of experimentation is getting younger and younger for some drugs, older for other drugs. I'll explain that in a minute. But just remember that initially it's sort of a fun thing and helps people feel better oftentimes, and that's what they remember. Interestingly, the adolescent substance abuse data shows that it's America's #1 public health problem, especially in the teenage years. if you use the first drug, first substance before age 15, 28% of people do. This is basically the percentage of the population that are 12 and under with a substance use disorder. It's now called not drug addiction, it's called a substance use disorder, an SUD. So 28% of people in treatment have started before age 15. 18% started between 15 and 17, 7.4% started 18 to 20. The interesting fact here is that only 4.3% of people in treatment started using after the age of 21. So there's a lesson to be learned here. You know, if we can keep kids from abusing drugs early on while their brain is forming, and remember that brains don't mature for most people until the age of about 25. We kiddingly say women, it matures right around 25, a little bit before men. And for boys, it often never fully matures, but it probably does, but 2 or 3 years after males. So the longer we go before we start abusing the substances, and when I say substances or drugs, please understand in this presentation, I'm talking about anything that alters the way the brain thinks. So whether it's alcohol or cocaine or marijuana or prescription medications, I'm only talking about drugs in the generic term. So please don't think when I say drugs that I'm not talking about alcohol too. We're talking about everything. So if first use is over 21, only 4% of people in treatment are likely to be in that group. And that tells us that the more we can delay early onset, the better we're going to be in terms of preventing problems. The research regarding when people are actually starting is a little bit varied. You can see on the trick to the left here. This one says alcohol, the average age of initiation is 16.5. But according to the American Academy of Child and Adolescent Psychiatry, the average age of starting alcohol is around 12, and the average age of starting cannabis or marijuana is 14. Cigars, 17, cocaine, 18, crack cocaine, about the same age, 18, ecstasy, 17, heroin, 17, and there's been an increase lately in the last 4 or 5 years of heroin usage because it's become so cheap. So before, 20 years ago, only really end-stage addicts used heroin. And nowadays, it's one of the more common drugs in young people, something we need to be concerned about. And even snorting things, inhalants, the average age of starting that is around 15. So I want you to understand some things about teen substance abuse. This is important to understand because it really will put a highlight on the significance of this for our society and for how things are going to be as these teenagers get older. Alcohol kills 6.5 times more youth than all other illicit drugs combined. So alcohol, in terms of which has the biggest effect overall, certainly it's alcohol. By 8th grade, 52% of 8th graders have consumed alcohol, 41% have smoked cigarettes, 20% have used marijuana. 28% of teens know that a friend or classmate has used ecstasy. 17% know more than one person who's used ecstasy. Traffic crashes are the greatest single cause of death for all ages between 6 and 33. And most traffic deaths are related to alcohol-related crashes. In other words, 45%, not most, but close to most, 45% of fatalities are alcohol-related. Crystal meth is now the most dangerous drug of small-town America. And kids between 2 and 14 living in small towns are 104% more likely to use meth than those living in larger cities. So we have to be aware of that when we're addressing the macro problem. And youth who drink alcohol are 50 times more likely to use cocaine than those who never drink. So when they talk about alcohol being a gateway drug, it certainly is. Alcohol lowers inhibitions, makes people want to do other things that are causing them to be fun or socialize with people who also are using substances, 50 times more likely to use cocaine than those who never drink. Over 60% of teens said drugs were sold or used or kept at their school. I've done talks at a lot of high schools and grammar schools, and I can tell you that that's absolutely true. In 2006, over 2 million teens used prescription drugs. So you can imagine this is now 2024. It's a lot more than that now. 15+% of high school seniors reported non-medical use of at least one prescription drug within the last 12 months. And 64% of teens 12 to 17 who have abused pain relievers say they got them from friends or relatives, and often, actually most of the time, without their knowledge. Teens whose parents talk to them regularly about dangers of drugs are 42% less likely to use drugs than those whose parents don't. So many parents just are afraid to talk to their kids about drugs. They don't maybe know what to say. They're not sure how to approach the subject, and so they just avoid it altogether. Or they abuse drugs themselves, including alcohol, and they don't want to talk about it because of their own use. But if you really want to protect kids, encourage parents to talk to their children about the pros and cons and let it be a discussable topic among them. But although that's true, 40% less likely to use drugs than parents who don't, less than a fourth of teens report having these conversations with their parents. Marijuana use is the same as about 5 years ago, so that's not changing a lot. And teens don't generally this time see marijuana now as dangerous. So because it's been legalized in most states, many teens just think that because it's legal, it's just like alcohol, and they don't see it as a danger at all. Prescription drug use and inhalant use have been steadily increasing over the last 5 years. I'd like to say a word about marijuana because it has been legalized now, and because of that, many people think that it is safe. It actually is not safe. There are no health beneficial effects that have been documented by any evidence-based studies about marijuana. There are short-term effects of marijuana, which is why most people use it, because they like those effects. It relaxes them, but it has immediate impact on their thinking ability, their attention, their cognitive, executive functioning, their short-term memory especially, coordination and movement are impaired, and time perception becomes impaired. And with long-term use of cannabis, it can affect brain development, and especially when you're using it as the brain is developing, again, before the age of 23 to 25. We see problems in older people that have started at those ages, in young ages, problems with attention, with memory, with problem-solving skills, and also just overall behavior, healthy behaviors using cannabis before age 18. And one of the biggest things that it really does with kids is when they use marijuana is it takes away their motivation and their drive. And I've seen lots of kids who come in with addiction, and their parents say they just become a totally different kid. You know, they used to be involved in sports or athletics, or they loved this or that, and now they just it doesn't matter much to them. They lost all their motivation. They're not studying. They just don't want to go to college anymore. All kinds of changes about how they perceive life to be, what their problem-solving skills are, how they analyze what's going on in their life. They lose those abilities. And we see similar findings actually in adults who continue to use marijuana over a long period of time. It's both physiologically and psychologically addictive. We thought for a long time maybe it was not addictive. We now know that it is. It's very difficult for people that are using marijuana regularly to get off of it. It's not easy to do. And there's a difference between two of the metabolites of marijuana. Marijuana is broken down into first hydroxy, THC, tetrahydrocannabinol, and then also carboxy, THC. And it turns out that hydroxy THC, that first metabolite, is the one that causes the symptoms that most people like. It causes increased in the munchies. They have, delusions, hallucinations, kind of things. They can get focused on something that's not very important otherwise, but they do. But those early on symptoms, when they smoke marijuana, what they like about it, besides the relaxation effects, are caused by the hydroxy THC. That is washed out from the brain in about 4 to 6 hours. And when that leaves, people think that they're just fine. Unfortunately, there's another part of the brain, another part of the marijuana, that's a metabolite that's called carboxy THC. Whereas hydroxy THC is hydrophilic. It's basically stored in the water cells. It's dissolved in water and it leaches out very quickly. So it's gone in 4 to 6 hours. But the carboxy THC is what we call lipophilic. It actually attaches to fat cells, and then it's much longer in terms of how long it stays in our system. We know that hydroxy washes out in 4 to 6 hours. Carboxy THC may take 4 to 6 days to go away. And for people that are using on a regular basis, especially people that have heavy fat content, overweight people, It can take up to 3 months to totally go away so that you've got decreased concentrations in your bloodstream below the level of effects that affect your brain. So what does it matter? Well, here's a study they did on airline pilots. They took airline pilots that had not used marijuana. They put them in this study and they gave them a joint. They had them smoke one joint and they immediately felt all the effects. Before they started the study, they put them in plane simulators and they all had perfect scores on their plane simulation, perfect leg takeoffs, perfect landings. After they had the marijuana, they had all kinds of problems, as you can imagine, with coordination and hand-eye coordination and spatial appropriate development and so forth with their vision. After 24 hours, they said they were all fine. They scored them. Do you have any side effects now? Are you fine? Do you feel like you're sober? Yes, they all felt like they were fine. They put them back in the flight simulators. They did the same study. Every one of them, after 24 hours, feeling fine, had major errors in takeoffs and landings, and one of them missed the runway entirely. So the bottom line lesson to take home here is that even though we may feel you're fine after you've used marijuana, unless that THC, that is carboxy THC, has washed out of your brain, you still may have significant alterations in your brain functioning, and you don't even know it. So the problem that I see with kids who are just using drugs like marijuana on just Friday or Saturday night, they think they're just partying, but Monday they're fine. They're not fine. They're drug affected 24/7 all week long, and then they use again the next weekend. So it is a problem. It is addictive. It's tough to get off of it, and it's something we all need to be aware of. So here's what I want you to see. This is important, I think, to really understand what goes on, and I'll explain this graph. The red line that goes up and down, that's kind of normal mood for most people. Some days are better days than others. Some days are worse days. We have moods that are up and down, but they kind of vary about that normative curve there in the middle. When people take drugs, the first drug, remember I said all drugs are euphorics? Well, that big thing you see right here, this big highlight, that's euphoria from taking the drug. And after you take the drug, you get a less effect, but usually there's not much of a follow-up negative effect from initial use of drugs. What happens is then, especially kids who start using drugs, and it happens with adults too, but with kids because the initiation phase is usually earlier on, they remember that high, and they remember the good feeling that high caused. And some of the big kids, they feel like, the addicts will say that first high was the first time my brain ever felt normal. It's the first time I really felt at peace with myself. The noise in my head went away, the committee in my head, they call it. And I never forgot that first feeling because it was so great. Most people, they feel high, but it's not that great. It's okay, but they remember it. And the next time they party, they remember it again. And it was kind of a fun thing. And there are progressions that go on here. And if you look at this one in the brown, you see the high becomes over time, it becomes less high and less high. And pretty soon it's not high at all anymore. And now it just gets low. I don't know why that happens, but that's what happens. And so when this progression happens, this is called tolerance. And what happens with repetitive use of a drug, it eventually takes more and more of drug to get the same effect. So people use more of it, they do it more often. The highs get less high, but they always remember how big this first high was. And certain people, everybody really, if you took statistically 7 people, out of 7 people in our country, probably 5 of them will abuse drugs or alcohol at one time. And all 5 who abuse substances at some point in their use history will have a problem. They sleep in too much, they fail a test, they get into a fight, they cheat, they steal, something goes on, they lose a job, they get with a drunk driving, something happens, and they have a negative outcome because of their use. And most all those people will say, I'm not going to do that anymore. I learned my lesson. I got hungover, I slept in, or I said something I shouldn't have said. I embarrassed myself, or I didn't do well on my test. Something happened, and I'm not going to let that happen anymore. And everybody promises themselves that they're going to change, and they all try to. But there are certain people who have a hard time changing. So out of those 7 people that abuse, 5 people 7 people that there are 5 people that abuse. And out of the 5 who abuse, all 5 will have negative consequences with repetitive overuse. And out of that group, they will all promise themselves they're going to change their behavior. But statistically, 4 out of the 5 can, and 1 doesn't. And the one who doesn't is the one who has a hard time, and usually that's the one who's genetically predisposed. So we say when genetics meets opportunity, we have addiction. And it's very unusual to see somebody who's in a recovery program that doesn't have some first-degree relative that also has a mood disorder or an addictive problem in the past. And so we now know that there is a genetic predisposition. We'll talk more about that a little bit later, but that's what happens. So what we see is tolerance, which is it takes more and more of the drug to get less and less effect. And then we see withdrawal coming in. The more you use over time, the downsides become deeper and deeper. And the end-stage addict is now no longer using because it causes fun and it's euphoric. They're now using because they feel so horrible when they're down here in this trough. They're just trying to get away from the feelings of withdrawal. And that's what's going on. And so even though they have negative consequences, they continue to use because their brain always remembers this high up here. They're always expecting to get that first high, but it's never coming again. Now they're just using to get out of the horrible feeling that they have in their brain when they're not using. And as this thing progresses, they become initially just interested in medication or drugs. They think it's fun. They like using it. And over time, they're not liking it anymore. At the end stage, they need it. So now these people aren't using because they like it. They're using because they crave it, and they don't know any other way to get away from the horrible feeling they have when they're not using. So that's the problem, and that's how tolerance can develop, and that's also how withdrawal can develop. So when genetics meets opportunity, we have addiction. Many people will have risky substance abuse. Some will have progression to substance abuse disorder where the substance is causing a problem in their life and they need some help to get over it. But remember, 4 out of the 5 people can just stop that because once they see the light, once they recognize the problem it's causing, they're not going to do it anymore. But 1 out of those 5 users who are abusers has addiction. And that person is the one who, in spite of all good intentions, in spite of trying to do it, trying to do everything they can to stop, promising themselves that they will, trying all kinds of ways to stop, they just find themselves unable to do it. And you go, why is that? What is going on that that's the case? So this is the progression that we see. Initially, drugs are fun. They're experimentation type usage. It's social. A lot of people feel like their social inhibitions are less. I've heard guys say, well, they can talk to girls better, meet people better, a little more comfortable. They have less stress, a little less social awkwardness. They feel comfortable. They also cause decreased inhibitions. They often will do things that they wouldn't normally do or say things they wouldn't normally say or use other drugs that they normally wouldn't use just because they have that. But when those things are starting early on, they're still looking forward to their next use. They're thinking about it. And then as it progresses, they're planning, they're thinking about it, even when they're not using. So when it gets to be a little bit dependent and they're using drugs, then not knowing it, but they're actually using it as a medicine to cope with their feeling state, now they start to be thinking about it more and more and more. They're planning about it. They're I'll call perseveration. They're just thinking about it over and over and over. Can't wait till the next use. And they change their social situation. They find friends that are using too, so their use won't look abnormal. They kind of stay away from a little bit people that are sober who are not using, or at least who are not abusing, because that's not a comfortable situation for them because they are finding that they need the drug and end up depending on the use to assist with those uncomfortable feelings. And then the negative side effects come. They promise themselves their change. It's harder to do it. Their behavior becomes more damaging to their self or to other people that they really care about. And what they find is their behavior is no longer consistent with their core values. So they say, I value my health. I value my studies. I value my job. I value my family. I value my relationships. I value sleep. I value being my best self. But they find that what they're doing with their substance abuse is taking away from every one of those core values. It's preventing them from being who they really could be. When that happens and they promise themselves their change and they don't, that 1 out of 7, well, they start to question their self-worth. There must be something wrong with me. I must not be smart enough or strong enough, or maybe I'm not morally good enough. And they start having significant self-doubt. And what you need to understand about substance abuse disorder, and especially dependence, it's a shame-based disease. Everybody who has addiction is very ashamed and feels guilty over what they're doing. They know it's not their best self. They know they shouldn't do it. They know they've got problems from it, but they just can't stop. And so they feel ashamed. They don't want anybody else to know what's going on. And because of that, they're more stressed. And when that stress increases, you see greater fear, you see greater anger, hostility, irritability, overreaction to things, the volcano eruption over little things that should be little things, but they're big things. And in order to continue what they're doing, they hide their use, they sneak things, they start lying, cheating, stealing, isolating, doing other risky behaviors. All those things are part and parcel of the person who's progressing down that addictive, slippery slope. They end up in a fear-based state. They have often panic attacks. In fact, I found clinically that if somebody comes in with a first complaint of panic attacks, there's a really good chance that those persons are abusing alcohol, because it's amazing to me how many people have panic attacks, but when they stop drinking, those panic attacks just go away. But they've often been prescribed benzodiazepines or Xanax or something, going to the doctor because they're panic attacks. They're treating the symptom of the addiction or the use, but they're not treating the root cause. Because when you stop the alcohol, then oftentimes the panic attacks just go away. And along with that, especially with other drugs like methamphetamine or cocaine, paranoia comes involved. All kinds of health complications, from cardiac to sleep to weight to self-care, all those things are impacted. And in order to continue their use, addicts will always do 3 things, because if they don't do these 3 things, they're not really able to continue what they're doing and needing to do, which is use the drug to escape their feelings. They deny that their behavior is causing as big of a problem as it is for themselves or for anybody else. They rationalize why they're doing it, and they minimize how much of it they do. And as long as they can keep those 3 lies in the air, they got like a house of cards waiting to crash down. But as long as they can keep rationalizing, denying, and minimizing, they don't really have to admit the truth, and they can fool themselves into thinking that they're okay. They're not really having a problem. They don't need to change. And along with that, decreased self-care, they withdraw from usually pleasurable activities. They stop doing things they're normally doing a lot. They stop sports. They stop socializing. Normally with friends and family, things that they would do, they just back off, or they don't show up, or they show up late, or they leave early. More fear, more emotional pain, more anger, more blaming. They find themselves inability to have really meaningful, transparent relationships. What we see is what happens is that they just find they need to keep other people away from them, because they know what they're doing and how they're feeling is not normal and it's not healthy. They know they're causing it by their choices of behavior, and they don't want anybody else to see inside the tent. So they create a wall around themselves to keep themselves safe. It's like a little brick wall around me. And you can't get inside that wall. You can talk to me about anything you want to talk to me about. We can talk about the football scores, the baseball scores, or other people, what they did last night. Talk about work. We can talk about jobs. We can talk about you, but we're not going to talk about what I'm feeling. We're not going to talk about where I'm at with my feelings. We're not going to talk about what I'm not comfortable with. And we're not going to talk about my pain, because that's dangerous. My fear is that if you got inside my wall and you really understood what I was feeling, that you'd judge me and you'd reject me. And unfortunately, I've already rejected and judged myself, and I can't take the thought of you rejecting me too. So it's a very isolated, lonely, painful place to be. And it's something that's very, very difficult, and they don't want to ever be disliked. And their biggest fear is if you take away their drug, if they admit what's going on, they're not going to be able to use their drug anymore. And then they don't know how to cope, because that's all they've learned in the last years to handle their problems. And if you take that away, they're afraid that they're not going to be in control anymore, and they're going to lose control. And that's a very, very scary thought. They've tried too many times to stop and not been able to do it. So they really feel like they can't stop, and there's no help to change. So it ends up feeling for that person, they have two thoughts: either I'm perfect or I'm worthless. And I know I'm not perfect, so I must be worthless. There's very little shades of gray in the addictive mind. And they're very much afraid for other people to see their imperfections, because again, they feel like if you see my imperfections, you're going to judge me and reject me. That's painful for me to consider. If I'm an addict, I can have a great deal, and I will have a great deal of empathy for others. Most addicts would give other people the shirt off their backs. They frequently, their families bring them in. They say they're the kindest person. They do anything for anybody, but they won't let anybody help them. That's because they know pain. They know what it feels like to be in trouble. They know what it feels like to be afraid, to be concerned, to be alone, to be doubting yourself. They recognize those feelings easily in other people, and they don't want other people to go through that just like they're going through it. So they would do anything to help other people, but they won't let anybody help them. That's the way it is. And this has nothing to do, you have to understand, with their intelligence. In fact, some studies show that the average addict is several IQ points higher than the normative person. So this isn't about intelligence. It's not about moral character. It's not about how good you are, how good your core is, what your core values are. This is about how the drug is affecting your brain. If you try to discuss these things with somebody, what happens in family dynamics, let's say a husband and wife, the husband comes home and he's drinking. The wife will say, you shouldn't have done that. You drank too much. You came home too late. I don't know where you were. You're driving while you're drinking. That wasn't good. Or we were socially event and you fell asleep with face in the mashed potatoes and dinner. That's not good. And the husband says, you're right. That's not right. I won't do that anymore. I'm sorry. That was just a one-time thing. I'll take care of that. The next time they do it, the wife says a little bit stronger, and he says, I know I can do it. Don't worry, I can do this. And the third time, he gets upset. He doesn't want to be reminded anymore about it. And he responds overtly with anger and hostility and resentment and even violence, threats, whatever, because he knows he can't change. And so he's only got two options. One is to react by retaliating. I'll blame you. You're my fault. If you weren't such a jerk, I wouldn't have to drink so much. Or by just isolating and staying away and escaping the discussion altogether. That's where it goes. And it ends up where it's been a problem for long enough. We've tried to solve it. We've not solved it. We can't talk about it because it just creates emotional distress. So we talk about other things. We talk about the fact that you didn't make your bed, or, you came home and, you didn't kiss me when you came home, or whatever it might be. We'll talk about everything else, but we're not going to mention anymore your drug use or your alcohol use, because we've tried that, and that just gets us nowhere. It just gets us into more problems. So that's where it gets to be the elephant in the room. It's the biggest problem of everything that's wrong with your life. It affects your job, your work, your mentation, your health, self-esteem, your mood, your sleep, your weight. It affects everything about your life. And we can talk about all those effects, but it's really hard to talk about what's causing those effects, because the emotional burden that creates for everybody. That's the elephant in the room. That's what makes it tough. And when people come in and they finally admit the truth, when they're finally at the point where, I just can't take it anymore, doc, I need some help, this is what they say. Every time I feel stressed or depressed or angry or whatever it is, I've learned to escape from those feelings by using my drug, right? But now it's not working anymore. Now I only use to escape how horrible I feel when I'm not using. And the highs are long gone, but every time I use, I just think it's going to happen. I'll be okay again, but it never turns out that way. And the truth is, doc, they say it's been so long since I've been in touch with my feeling state that I don't even know who I am anymore. I'm embarrassed. I'm ashamed. I feel guilty. I hate myself. And they'll say that. They'll say, the truth is, doctor, I hate myself. I'm unlovable, and I don't think anybody could love me, and nobody could even understand the way my brain is torturing me, and the way it's making me feel. And I don't know what to do, but I don't have any hope. And that's the way that the end result looks before people are often willing to get treatment. So now I want to tell you why that is. It seems crazy, right? You think, why don't you just pull yourself up by your bootstraps and stop that stuff? You see what's going on. You see the problems it's causing. Why don't you just stop? Well, people can't. And the reason they can't is because of what I'm going to show you now. about 1 out of 7 people, 13 to 14% of the population, has addiction. And addiction is primarily genetic. And what we're finding now in the research, there's many genes, multiple, probably over 15 genes now are being studied with their effects in addictive behaviors. And it turns out that different genes can code for tendency to be addictive with different types of drugs. So some code for more response to alcohol, some to more response with amphetamines or stimulants, some for painkillers. So it's involved in the brain. We don't really understand all the whys, but we know the brain is very sophisticated and it's incredibly important. The brain is not simple. One of the founders of the double-stranded helix, DNA, the secret to the replication of life, said that the brain is the most complex entity ever discovered in the entire universe. I think that's probably right. Here is a picture of the brain. This is called the Glass Brain Project. It was done up at UC San Francisco, and it shows they've coded different neurons colored different colors. And you'll see this brain turn around, and while this person is turning around, they're blinking their eyes open and shut, and they're moving their hand and finger, just one finger like this. That's all the activity that's taking place. But look at the brain the activity that's going on with these nerves firing back and forth. I was talking one time with a brain scientist who actually won a Nobel Prize for a study with the brain. And I said, tell me about the brain. Tell me about these neurons in the brain. I said, I've learned that there's 50 billion neurons in our brains. And I've just read a recent article that said 100 billion neurons. How many are there really? And he kind of laughed at me. He kind of smiled. He says, well, nobody's ever actually counted, but it's probably on the order of magnitude of 100 billion neurons. But he said, that's not what's important. I said, okay, what's important? He said, what's important is how many synapses there are. That's the connection between the neurons, because that's where the action is. And I said, okay, how many of those are there? And he told me it was a big number, and I forgot. Now, what this is doing right now, it's focusing in on the brain and what we call the corpus callosum. You see these fibers going sideways here. That's the corpus callosum, is the part of the brain that connects the right hemisphere and the left hemisphere of the brain. But just with that little bit of activity that person was doing, the brain is firing back and forth all kinds of messages, signaling to keep the body safe. So what happens in the brain is we've got all these things going on all the time. We're not even aware of it. So in the brain, we have synapses, we have connections, we have neurons. The neurons are made up of dendrites and axons. The dendrite is the receiving end of the molecule. So if you look at this brain right here, on the right-hand side, you see this thing with all the tentacles sticking out. That's the neuron cell. That's the core of it. But you see all these different tentacles sticking out. It's not like one neuron connects to one other neuron. Neurons are plastic, and they've got all these tentacles that connect with all kinds of other neurons. And they all have a giving end and a receiving end. The receiving end is called the dendrite. The giving end, where it sends messages, that's called the axon. And between the two, you have a synapse. The synapse is the connection between one neuron and the other one. This is called the receptor site, and this is called the neurotransmitter. So the way that one neuron communicates with the other neuron is it has these neurotransmitters made up of amino acids that are sitting on the end of the neuron, the end of the axon. And when the cell becomes stimulated, a little bag of those neurons gets released, and then these neurotransmitters fly around. They find receptor sites on the next neuron ending at receptor sites, and they attach to the receptor site and stimulate the next nerve to fire. So the neurotransmitters communicate from one nerve to the next, and when they do, they cause proteins to be produced, hormones to be made, etc. This controls everything that's important in our body. Our brain signals everything to happen. Nothing happens without the brain doing it. So I said, how many synapses are there? If there's 100 billion nerve cells in the brain, tell me how many synapses there are. And basically what he said was, it's a big number. And he told me, and I actually forgot it. I called one of at that time she was the Howard Hughes Research Fellow at the Salk Institute. I said, how many synapses are there in the brain? Because I was giving a medical talk and I wanted to be accurate. She said, not known really, but there's a lot. And I laughed, and she said, probably on the order of magnitude. This was an email, and I will never forget it. She said, probably on the order of magnitude of 10 to the 12th to the 15th power. Well, 10 to the 15th power is 1,000 trillion connections. And then she said, many of which are in a position to be modified by the sequelae, the outcomes of fear, compassion, or loving kindness. I go, ooh. So here's a world-class scientist saying that the way the brain works is it can be modified as plastic, and the neuroplasticity of the brain can be actually changed. It can change the anatomic connections between our brain and the way the brain works based on how we think and how we feel, not just what we do. This was revolutionary, and now we know this is hard science. This is true. We know that we've got about 1,000 trillion connections, and that every time one nerve fires, up to 40,000 other nerves fire in sequence. And if you've read the book Outliers, it talks about what it takes to be world class in anything, whether it's athletics or art, dance, whatever it might be. And the answer was it takes about 10,000 hours of practice before you can be world class. What he said in that book was that, interestingly, we think world-class performers are genetically endowed. Well, he said, most of us have the ability genetically to be world-class, but we just don't have that training of 100,000 hours, especially early on in our life, or 10,000 hours, I should say. So what we do know is that neurons that fire together wire together. And every time we do something from 1 to 40,000, we're laying down hard wiring in our brains that stays that way. And then later on, we can go through that pathway without even thinking about it. That's how a concert pianist, when they start playing the piano when they're young, it's hut and peck, right? And it sounds awful. We look at them playing a concert and they're eating a sandwich and waving to the crowd and they're playing Tchaikovsky's whatever. And they're not even thinking about looking at the notes because they've got all those neuromuscular neurons hardwired once they start thinking about that. And that's the way our brains work. And that plays into addiction, which I'll explain to you. So what are these neurotransmitters? We've got a bunch of them that we know about. There's many that we don't even know exactly what they do, but there's some that we've heard of and we know do what they do. Acetylcholine affects motor neurons. So things that affect motor neurons, physical activity, contraction of muscles, those are regulated by motor neurons receiving acetylcholine receptor site stimulation. Dopamine, we know about that, right? Dopamine's the pleasure receptor, but it also not only gives us pleasure and satisfaction, but it activates motivation, it activates memory, it activates healthy sleep. GABA aminobutyric acid, known as GABA, that's now drugs are used. GABA, we use them initially for stopping seizures because they're reducing excitability in the neurons, but it also codes for improving sleep. We can use that as a sleep medication, prescription-wise. It's also an analgesic, so we use it now for nerve pain. So people that have herpetic neuralgia, we use gabapentin as something that helps the nerve pain resolve. Serotonin, we've heard about that. That regulates mood. It regulates happiness. It regulates appetite and cognition and reward. It's a reward system, and it also has a big play in memory for us. Epinephrine and norepinephrine are two stimulant neurotransmitters, and they hit receptor sites that cause us to be more activated. That's what we use for people that have ADHD and so forth. So they get them to focus, we use stimulants. Histamine, that's something that we have, if we have allergies, we have histamines that are more activated. That's what we use antihistamines for, to decrease the allergic reaction. Most of us have now heard about oxytocin. That's the love hormone. When we hug a newborn baby, when a mother and the baby snuggle right after the baby's born, both their oxytocin receptor sites become stimulated, which creates a feeling of trust, of love, of safety, relaxation. And endorphins, we've heard about the runner's high. When we're doing something in long running, for example, that's pain control. If we didn't have endorphins, the runner wouldn't feel very good. He'd have pain because of all the stuff he's doing to his joints. But endorphins increase analgesia. They actually elevate our mood and our overall sense of well-being. So all these neurotransmitters are part and parcel for a healthy, well-being life. What we have to understand is that every drug that affects the brain does so by fooling the brain into thinking that the drug is a natural neurotransmitter. So every drug of abuse, whether it's cocaine, for example, affecting acetylcholine neurons, or cocaine affecting norepinephrine receptor sites, all drugs fool the brain into thinking that they're the normal neurotransmitters, and they act as surrogate neurotransmitters. And that's what's going on. That's how drugs get past the blood-brain barrier, because they look very much like normal drugs. Most things shouldn't get past the blood-brain barrier to get into the brain. But all drugs, whether they're analgesics or sedatives or cocaine, marijuana, hallucinogenics, inhalants, all those things fool the brain because anatomically they look very much like, not exactly like, but very much like neurotransmitters that are supposed to be in our brain. They fool the brain. So what happens when we start using drugs over time? The receptor sites initially, they see something coming in that looks very much like neurotransmitter, but it's not exactly like that. So they actually, anatomical imaging studies from electron microscopes have shown that the receptor sites actually initially, they fit like a lock and key. So here's the neurotransmitter and here's the receptor site, like a lock and key. The lock, it fits it exactly, but it didn't exactly fit the surrogate neurotransmitters of the drug. So actually the electron microscopic sections show that the receptor sites actually change their configuration anatomically to more precisely fit the drug to allow the drug to be used, because that's what we're feeding it. So the body tries to accommodate what we ask it to do. So it works nicely, right? Initially. And then with repeated use, we get overstimulation. The brain doesn't like to be overstimulated. We always like to be about the norm. When the brain becomes overstimulated, it wants to downregulate. It wants to not be overstimulated. So now it makes changes so that it won't be hypersensitive. It does that basically initially by decreasing how many neurotransmitters of its own it makes. So our brains stop making the normal amount of neurotransmitters that keep our brain working well, cohesively, like an orchestra. That decreases the stimulation. And when that doesn't work, because we're still using the drug and we still get overstimulated, it tries to downregulate more by actually atrophying receptor sites. So it has less receptor sites. So for example, on the end of a rat that's been addicted to cocaine, there's only 20% as many receptor sites as there are on a normal rat receptor site end of the neuron. They've lost 80% of the receptor sites in an attempt to decrease the ability to be overstimulated. And when that doesn't work, the toxic effects of some drugs is to actually destroy and kill receptor sites. So that explains why more and more causes less and less, because the brain now, we're not getting our own mechanisms working. We just have the outside drug. Before we had both. So we get hypostimulation. And now when we're not using, we feel awful. And that's called anhedonia. Anhedonia is the total loss of enjoyment in life. And that's what happens biochemically once we're in withdrawal. And when we're in withdrawal, we have an increased craving. There's a need to repeat the addictive behavior to get out of that horrible feeling that that creates. And we have a downward spiral of physical, emotional, spiritual, relational bankruptcy. It's just everything is working poorly. So here's what it looks like in a normal neurotransmitter. This is the axon on the top. And on the bottom of the top slide here, this is the receptor site. So the axon has these little amino acid neurotransmitters. The neuron gets stimulated. This bag breaks open. These neurotransmitters fly around and they fit into the receptor sites. When you've used drugs and you're getting tolerance, what happens is you've atrophied receptor sites. So now we don't have 6 anymore. Now we've only got 3, less places to stimulate. So there's down regulation of the overstimulation. And some drugs cause toxicity to neurons and they actually get killed. So there's no receptor sites at all. So that's why we see tolerance. That's why we see tolerance. And then when we don't have the drug and we don't have our normal receptor sites and we don't have our normal neurons, now we've got tremendous dysphoria, lack of normal mood, and that's what causes the withdrawal. So that explains tolerance and it explains withdrawal, what's really going on. And here's the MRI studies of a control on the left side. All the red dots, this is a PET scan that shows stimulation of the brain. So every red dot here in the intensity of the red dot, that shows you oxygen and glucose utilization in the brain. This is how much the brain is working. Every one of those red things is increased glucose utilization. Here's a cocaine addicted brain. It just shuts down. It doesn't have the ability or the need or the desire to be stimulated anymore. It's lost its ability to become normally stimulated. That's the change that you can see. And so you can see what happens when you get down into this side here, what's causing this withdrawal and lack of stimulation. You can't get this big high anymore. This is a biophysical thing. You can't get it. It's just the way it happens with brains. I told you I'd mention a bit about opioid use. Opioid use has, in the last 10 years for sure, 5 years especially, increased. 70,000 people have died from drug use in 2019. 1.6 had an opioid use disorder in the past year. It's a big deal in our country now. You see all these statistics here. It's amazing now how opioids, doctors were convinced by pharmaceutical companies for a while that opioids were safe to use, that we should treat pain until it's gone, that it won't be a problem, and long-term opioids are going to be okay. And it's just not the case. 2 billion people used methamphetamine last year. That's a big drug that's hauled across the border. There's two main cartels I found that are shipping methamphetamine. Most of it's made in Mexico into the US. And they know that there's going to be deaths from methamphetamine use. And they also know that there's other things. Fentanyl is now being put into the drugs. All these things, that fentanyl is a synthetic opioid. It's way, way more toxic than regular, even methadone and morphine. But they know that, this as an aside, they know there's going to be some deaths, but it doesn't matter to them because a number of people that'll get through and the amount of money they can make on those drugs is amazing. Rather than shipping in big tons of marijuana and things like that, big trucks, they can, in a backpack, they can put 20,000 pills, and their return on investment is very great. So it's a big problem. We're trying to face it now and figure out what to do about it. The problem is, within somebody's given a 10-day supply of opioid. These are people that do not have cancer. They don't have long-term chronic pain that's unbearable. These are normal people that just have a short-term problem. If you give them the 10-day supply of opioids, 1 in 5, 20% will become long-term users. If you give them a 30-day supply, the CDC shows that the chances of them being on it for a year is 45%, almost half. If you just give them one 30-day supply, you're starting that deal. It's very addictive. Long-acting opioids are even more problematic. So we're trying to be teaching doctors just to use short-term when they need it, and not more than for a couple of days if needed. If people get a second prescription, no matter how many pills were written in the first prescription, it could be just 10 pills. But if they get a second prescription, 1 in 7 were on the drug for at least a year. They'd figure out a way to do it. So the opioid epidemic is really a significant thing. One other thing you should understand is that we talk about drugs with addiction, but the brain has the ability to be addicted by any obsessive compulsive behavior. Remember what that neuroscientist said? Many of those synaptic connections are in a position to be modified by the biosequelae of fear, compassion, or loving kindness, but also by anything else that causes dopamine stimulation in our brain. So alcohol, drugs, sex, gambling, relationships, work addiction, exercise addiction, shopping addiction, food addiction, all these things can actually tap into the brain's neuroplasticity and create addictive lines of behavior, the 1 to 40,000, so that what happens is actually that when people have stress, whatever they do to manage their stress initially, when they're first trying to manage stress as young adults, that becomes remembered and hardwired in the brain. And the next time they have stress, they're going to try and do that very same thing again because they know it worked before. And if that's exercise, you could be an exercise addict. If it's sex, you can become a sex addict. If you found out that being the star athlete was what gave you all your pleasure, then you're going to be obsessive compulsive about being the star athlete. If it's a relationship addiction, you seek one relationship after the next and then they get tolerance to that. So brain changes can occur when the addicted gambler goes all in on the Vegas game table. The neurotransmitter changes and the receptor site stimulation changes are exactly the same as seen in the cocaine addict when they shoot up cocaine IV. And if you have blinders on the imaging radiologists that are looking at the brain scans, they can't tell the difference between the gambling addiction stimulation and the cocaine addict stimulation. It hits the same sites in the brain. Sugar, very addictive. Sugar hits the tongue, and within 2 seconds, it hits the brain receptor sites, gives us pleasure. So sugar is a very, very tough addiction to solve. So what do we do? We've got somebody who's addicted. They're using or abusing some substance. They're having a problem with it. Here's the model. This has been developed. And how do you have an intervention in that elephant in the room? How do we get past it without having a fight? You own your own feelings. And this is essentially what you say. Go through it. It's very complex, but I'll sort of dumb it down. The first thing you say is, and notice these are all I statements. None of these are you statements. We're not blaming. We're not judging. We're not criticizing. We're saying, I care about you. The reason we're having this discussion is because I care about you. I love you. The next thing we say is, here's what I see. And the subjective things that you've experienced yourself when you're in the presence of the other person. I've experienced you coming in late. I've experienced you falling asleep with your head in the mashed potatoes at dinner. I've experienced you getting into fights. I've experienced whatever it's been that you've seen and observed. I've seen you yell and scream at me when I didn't bring in the trash appropriately. It seems like an overreaction. Whatever it might be that you've seen that seems not right, you can mention that. It's my observations. I know the next thing you say is that you wouldn't intentionally affect me any other way than to be positive. Your intentions have never been negative, but this is what I've seen. And what I'd like you to do is I'd like you to get evaluated, or I'd like you to stop the behavior. I'd like you to get treatment for the behavior. I'd like you to get a consultation about the behavior, because I know that you wouldn't intentionally cause those things for yourself or for anybody else. And if you'll do that, I will be a best part of your team. You know, I've had athletes tell me we're doing intervention to another player, and the guy says, if you'll clean up and not use drugs, I'll be your best buddy. I'll sit on the plane with you. I'll be your best friend. I'll keep your bad druggy friends away. I'll do everything I can do to help you succeed in any way that I can. I will be your partner in recovery. But if you won't, here's where you have to have the boundaries. And this isn't about hurting the other person. This is not punitive. This is taking care of yourself, so you're not letting the other person's effects of behavior affect you adversely. And you're also teaching them to have the consequences of their natural behavior. So there isn't anybody that is an addict, pretty much, that doesn't have enablers along their life's way that allows them to not experience the natural consequences of their choices. So the parents will keep their kid from, getting kicked out of school by calling him, tell a teacher he's got a sore throat today, when they know he's just sleeping in it because he's hungover. Or the wife will call in and tell the boss, my husband can't come in today because he's sick. He's not sick, he's hungover. So most people have basically enablers that enable them to continue their abuse. They're trying to be good. Their intentions are to not let the other person hurt. We don't want to see them in pain. So we coddle them and we protect them, and we don't want other people to know what's going on. But setting boundaries is one of the healthiest parts of recovery. This is what I want from you. This is what I'll do to help you. If you won't do that, here's the boundary that I'm going to set, so I'm not a part of the problem any longer. The next thing you say is, I know you can do this. You're worth it. You're better than this. And let's do this together. We can do it. We can succeed. And the reason is because I care about you. So the first thing and the last thing you say is how much you care. It's got to be really honest. It's got to be from the heart. If you trump it up and pretend like it's more than it is, they will see through that in a nanosecond. But a healthy intervention model is a way to own your own feelings, to state the truth, to ask for help, to be part of the offer, being a partner in that help. And then you see where it goes from there. But you can't control other people's choices. You can only choose and control your own behavior and try and be a healthy participant and help. But before asking somebody else to get help, just make sure you're prepared to do the same thing for yourself. Many people will say, well, me, what about you? And so you got to look in the mirror and make sure that we're honest here. And honesty is the key. And statistics show that addicted persons have a far greater chance of succeeding with their families if the families are educated and in recovery too. So families get sick together and families get well together. Joe Persh at Long Beach Naval Hospital, Captain Persh in the military, naval doctor, revolutionized the way we treat addiction. We thought that people had to reach absolute bottom before they were able to or willing to get help. He showed you could order people into treatment. And if you treated everybody the same, you got rid of this feeling of terminal uniqueness. I'm special because I'm an officer. No, you're just Bill. And you're Bill, you're right next to the private Bill over here. That if you surrounded people with a healthy milieu of unconditional love, acceptance, honesty, healthy boundaries, information, healing techniques, etc., the same percentage would be able to get recovery than people who asked for help. So people don't have to be at their absolute bottom. As we say, it's a one-way elevator. You get off any floor you want, but you don't have to go all the way to the bottom, but it's only going down. Addiction, untreated, only gets worse. It never stays the same. It only progresses, it gets worse. And in recovery, here's what people learn. It starts with surrendering to the truth, letting go of your self-image, getting your ego out of the way, your need to control. People think, I just got to try harder. I know I can do this if I'm just stronger. So I just got to be in more control and suck it up. And I know I can do this. No, that's the absolute last thing they need. What they need to do in recovery is let go of their illusion of control and trust somebody else can help them that knows more about this than they do. Their way hasn't worked. Otherwise, we wouldn't be here having this conversation. So it starts with understanding and being honest about your story. Here's my story. Here's what happened to me. Here's when it happened. Here's how that felt to me. Here's how I handled that. It tells human suffering, and it tells pain, and it tells honesty, and it tells connection or lack of it and need to understand it. But the story is where people can start to heal when they really have the ability to look in the mirror and have what I call courageous honesty, talking about the truth about me. Here's how I really feel, and here's my fear, and here's where I'm stuck, and here's where I need help. Pascal has had a great quote. He said, in order to recognize the truth, you must first love it. And loving the truth, learning to have the courage to love the truth is a very courageous act. And Carl Rogers, the godfather of present day therapy, said only after we accept the truth, then can we change. So as long as we're kidding ourselves about what the truth is, we're never going to have a price or choice of changing. We're just going to stay and repeat the same bad habits over and over and over. Recovery involves getting in touch with our feelings. Those feelings, what we've done with addiction is every time we get uncomfortable feelings, we shove them down and we run away from those feelings by going into our addictive behavior. So healing starts with opening up those feelings, getting in touch with them, learning what those feelings are telling you about yourself, and then acting on their behalf. And Edie Eggers, a survivor of Auschwitz who gives talks to psychiatrists, amazing. She says what they've learned with survivors of Auschwitz, the ones who got in touch with feeling state and a purpose for their living are the ones who could survive. But she said there's no healing without feeling. So feeling and getting in touch with feelings, warts and all, is key part to the overall recovery process. Learning to accept help from others. Addicts don't want help from, they want to keep their wall up. They don't want anybody inside. But it starts with getting in touch with the fact that, I need help from others. None of us as smart as all of us, and I can't do this by myself. We say it's the only thing you've got to do. You've got to take the step by yourself of going where you've never gone before to trust other people. You have to do that step alone. But you don't have to do it by yourself, because if you have other people to be with you when you take the step, then you've got a surrounding, loving support system that can help you take that risk. Self-discovery, it's all about in recovery, learning who you are, why you're that person, what's uniquely special about you, and how miraculous you are, how worthy you are, how lovable you are in spite of your warts, and give that forgiveness and self-acceptance to yourself. And then having a disciplined plan for succeeding and being willing to pay the price for success. We say that, cancer has a much worse prognosis potentially, because many forms of cancer, if you're in the lucky group that responds to chemotherapy, maybe you can survive it, but 50% aren't that way. The interesting thing about addiction is you can have pretty much 100% success, even though the outcomes are worse. The outcomes are, nobody really has exact statistics, but well over 50% of people who go to recovery don't stay in recovery. They relapse. And most people who have addictive disease, that 1 in 7, die from the disease, many of them untreated. Some complications of the disease. But if you're willing to pay the price, if you're willing just to show up and do what they ask you to do in the recovery programs, you can succeed. You can choose to be in that top 50% who make it. It's just a choice, but it's a courageous choice, and it takes a lot of work, and you have to be serious about it. So we teach people that the truth will set you free. It starts with learning your story, sharing your story, learning the truth, connecting mind, body, having courageous honesty, and then a whole group of things with education and understanding, insight therapy, self-love, learning to forgive other people and yourself, connecting with a community of people that are healthy people. We say you're the average of your three best friends. And if your three best friends are in recovery or sober or living a healthy life, then much more chances you're going to do that than if your three best friends are addicts as well. Having hope for change is critical. Learning the skills to prevent recidivism, relapses. One person goes into recovery. Out of the 10 that go into recovery, 3 or 4 or 5 will relapse at some point. Probably 60% of people relapse at some point overall in recovery, but a relapse doesn't mean you're going to fail. And having an action plan for whole body wellness. The bottom line is we look at sobriety as just one important part of wellness. Many people get overboard. They think, oh, my recovery program is the whole deal. Well, it's not the whole deal. It's no more important than nutrition, than exercise, than sleep, than healthy, transparent, intimate relationships, than self-care, self-love, forgiveness, a whole wellness deal. That's why I said it early on in this talk. The keys we learned about what addicts have to do to be well and to stay healthy and stay in recovery, all of us can choose to do to be our optimized self. It's the very thing that addicts do to have really healthy recovery is what all of us could choose to do to optimize our well-being in life, our gratification in life, our meaning and purpose in life, and our satisfaction, as well as our longevity. So that's the key. So it starts with just accepting our humanness. It's okay to have pitfalls, we all do, but being willing to be accountable for my choices, to get help, to give myself love and acceptance, and knowing that it's a lifelong journey, just one step at a time. We're not here for perfection. It's progress, not perfection. And we're striving just to be giving up all hope of a better yesterday, but I know I can be better tomorrow. And that's what I want. Everybody wants hope and everybody wants to be all they can be. You can do that, but you can't do it alone. So help is it. And if you do all those things together, the freedom, the joy, the love, and the peace you have is more than you could ever imagine. It's one of the most wonderful things I've ever been involved in the medical practice of family medicine, just helping see this process happen, helping see people get their whole lives back, and they get their families back, they get their relationships back. And what they can do is amazing in recovery, but they've got to be willing to do that work and to give up trying to control. And oh, by the way, your brain can recover too. The healthy control is on the left. In the middle is this 1 month of abstinence where you see the lighting up of the brain starting again. And after 14 months of abstinence with a methamphetamine disorder, you see this 14-month sober person looks almost the same as this person. But if you're not willing to take that chance and do recovery, there's a whole hundreds of thousands of people in our country that have what's called post-drug impairment syndrome. They have continued their addiction for so long, their brains can never fully recover. They're never going to be normal again, no matter what they do. And oftentimes that's combined with mental illness of other types too, dual diagnosis, we call it. But with good recovery, people can recover and your brain can recover. And all those changes I talked about, they can all turn back to normal for most people. It's a family disease. And remember that families heal together and families get sick together. So unless the family, though, gets well, it's really hard to take somebody who's been treated and now they're talking and moving and discussing things and thinking normally. You put them back into a complex, dysfunctional environment of their family that didn't get treated. It's easier for them to go right back to their old behavior than it was to put up with this family that's totally dysfunctional. So everybody has to get well together. Everybody has to heal together. And if we do, then we can all do it. So it takes everybody being honest, everybody having respect for each other. Remember that honesty is the highest form of intimacy. And in a healthy family, there's no secrets. There's just help and honest. And I'm going to help you, you help me. Together, we're more than either one of us can be by our alone. And all of us have tough love. We're not enabling each other. We're just giving each other information. We're promising to be a healthy partner for each other in our total success. So remember, enablers are addicted to the addict. The addict is addicted to their addiction. So we all have to recognize that, recognize what our parts are in, and improve. Different people in the family, these are the roles that people play in the dysfunctional addicted family. One person's the caretaker. That's the person that is preventing, this is the big enabler, the person that prevents them from It's okay. You're going to be all right. We'll just put you to bed and we'll do better tomorrow. This is the person who's in bed. Then the hero is the one this is the kid who gets straight A's and he's the captain of the football team or the cheerleader or whatever it is, the A student. This is the one that's proving that they're worthy. They didn't get that self-esteem at home. They're going to prove it by showing everybody how good they are, how perfect they can be, so nobody thinks that they've got a problem. This is the person that's the scapegoat. This is the one that acts out. The other kid who gets on drugs, if you're going to do that, I'm going to do this. And they try and distract the attention from the addict by drawing attention to themselves, mostly with dysfunctional behavior. This is the kid that just taps out. This is the one that they shut down all feelings themselves because it's too painful to be home. So they just repress all their feelings, don't talk to anybody. They keep it all inside, terribly alone, terribly afraid, nervous, totally dysfunctional, has no good relationships because they've never learned to have them. And they think it's all their fault. And this is the kid that just wants to keep everybody happy and smiling. They're the class clown. If everybody just keep everybody laughing enough, then it won't be so serious around here and nobody will hate me as much. That's all the roles people play, all in adapting to this dysfunctional family addiction situation. So we can all get help. None of us is as smart as all of us. There's organizations in the country that are pretty much for every kind of addictive behavior. And the key is to take advantage of what you know, to spread the word, to have this be a discussable thing so people can talk about what they're going through, not something they have to hide, to get rid of the social stigma of addiction. We think of addicts typically socially as undesirable, as not very smart, as losers, etc. This is the disease process. We say when opportunity meets genetics, we have addiction. But once they're addicted, until they've got treatment and education about it and support for it, they can't make healthy choices. They don't even know what the healthy choices are. They're just trying to be happy like we all are. So I hope this gives you a broad stroke understanding of the nature of addiction, how effective it is in terms of how 1 out of 7, 13 to 14% of the population, it's everywhere. Once you start to recognize it, you see how many people it's affecting. And the ripple effect of recovery is huge. So please be part of the recovery system, not a part of the problem. Thanks very much. I'll look forward to answering questions.
How long have I known you? 50, 60 years? No, I mean, I've probably known you 20 years or so, right? I mean,
about right.
And I get to talk to you privately all the time. I always tell people that if I had to name doctors who are my top 3 to 5 friends that I talk to on a regular basis or I lean on, you're always in that top 5. But the funny thing is I hear you on the phone and I see you, but I don't get to see what you do like that. So it's incredibly impressive. And there's so much there that when we talked yesterday, I thought we would just do a really short Q&A. Then we would take a break because just to absorb that is intense. And then in a couple months or who knows, a couple of weeks, we're going to do a part 2 where Alex and the team collects some of the most common questions on addiction, how, when, where, what to do. And then we'll come back and just ask you the questions so the audience will really take over the role as moderator, not me. So I want to tell you why I'm sort of at a loss of words and not many signs after doing this for 15 years or so. I'm at a loss of words because after 30 years of being a part of advocacy groups, all sorts of advocacy groups, I always found it interesting that we never really touched upon addiction. We don't really say the word. We just kind of let other people handle it. And you sort of broke the mold here, the ice, because you're the first person that I know in a long time that covers not only a men's health area, but we also have a lot of cancer patients who's actually talking about addiction. So I just want to thank you for that because it makes me think we probably should have done this 10 years ago, but at least we did it, right? That's better than nothing. I just want to talk about briefly the physiology of it, if you can just repeat it, because I've looked at a couple of books. They call our generation the self-medication generation, even though I think that's every generation now, because like you said, it affects all ages, right? Search and there's this philosophy from a lot of books. I read one from Stanford and other places. People get dopamine depleted. There's just this search for more and more dopamine. So can you re-explain that? Because I'm going to give you my personal quick story, and I've told you this probably 20 times. I'm so sick of putting you to sleep on this. In college, a bunch of us got addicted to smokeless tobacco to stay up late and study. And I thought, okay, I didn't like coffee. I didn't like caffeine. I'll be fine. I'll just quit it after I graduate. And I told you the story of it took me, can't even tell you how long, how many times I would throw it in the trash and then I'd go dig at the bottom of the trash to find it. And I began to realize that I don't even know what I'm doing here. Addiction is so strong. So again, can you repeat? Because what's happening is these chemicals are just are putting our foot down on the gas pedal all the way to the bottom, right? I mean, the desire is so great. Can you go back over the physiology in your mind of why it's just so hard to quit?
We're all dopamine seeking humans, right? It's just natural. We want to feel good. And so when we do anything that stimulates dopamine receptor sites, remember, there's what I didn't say, and this is good information, I think, to think about. The brain has several parts that are very important to understand. You have two areas of the brain that store memory. One is the hippocampus. That stores factual memory, like what's your phone number when I want to call you or text you, that's your email address. The words to the Star Spangled Banner, unless I'm singing in front of a crowd, then I'll forget them. But that's hippocampal memory. The amygdala is the area in our brain that stores emotional memory. And anything in our life, especially when we're young, that affects us emotionally in any significant way is hardwired memory in the amygdala. And that is associated then if it's either a good memory or a bad memory. That could be somebody abuses me, somebody shames me, somebody makes me feel badly about myself, or I win the contest. I do something that just makes me feel great. Those extreme feelings are remembered in the amygdala. And everything associated with that act, that event, is also stored there along with it. That's that memory. And so in the future, once it's there, it's hardwired. Anything in the rest of my life that reminds me of that same feeling sucks me right back into that memory of what was going on when that first thing happened. So if I really felt like I told you that when you see that big euphoric state that goes up over the first use, addicts, turns out, what we did say before is important to understand too. The difference between the addicted brain, the person who's going to become addicted, and the normal brain, the person who's not likely to be addicted, is that the addictive brain is genetically already a little bit dysphoric. There's something that's wrong in that brain. When I talk to people, I say, well, when did you first use? Well, I first started using when I was 11 years old, but I never felt good before that. And they have a hard time describing it exactly, but they talk about it like an angst. I felt this little angst in my brain. And when I used the drug, that angst went away. Those voices in my head, always talk, the good bird, the bad bird, talking to me on both sides of my head. I felt at peace. And I'll never forget that first piece. That's that first cocaine addicts is the cocaine high. They never forget that first high. That's what normal people feel often. But addicts never felt that at all. So when they feel that from whatever it is they do, whether it's from sex or from drugs or rock and roll, whatever it is, they'll tend to repeat that behavior because they want to get that feeling again. And when you repeat that behavior over and over and over, especially with drugs, it supersaturates your receptor sites. See, normally not all of your receptor sites are stimulated. Some are in recovery mode. But when you take in a drug, you're not back. When you're just living life normally and your dopamine receptor sites are stimulated, they're stimulated because it's something you've done, something that needs it. It's an appropriate stimulation. And then the other thing that's important to understand is that when neurotransmitters are released, they hit the receptor site, they stimulate it, and then the receptor site lets them go. They go back to the nerve they came from, they get repurposed, and then they can come back again for another stimulation. So the percentage of receptor site stimulation and the degree of stimulation is very about a normal mean in the normal person. When you use a drug, you're not doing a dosed amount that's therapeutic that your own body would give you. You're giving a saturated amount. You're totally saturating all your receptor sites. And that's why you've got that tremendous euphoric stimulation way above what you normally would feel. And then if you repeat that, your brain doesn't want to be overstimulated. Our brains always in our bodies always want to return to normalcy. And we like about a median, up and down, up and down. And so if we're tremendously frequently overstimulating our brain changes its anatomy, it changes its own receptor site production, it changes the number of receptor sites available to always try and down-regulate that tremendous overstimulation to be normal again. But the trouble is then when you stop the drug, now you don't have the drug or your normal chemicals or normal anatomy, and now you're feeling awful. And that's when that rat study, that's when you're feeling that awful, that's when you'll do anything that your amygdala remembers that you did to get you out of that horrible feeling. And that's the
Yeah.
cycle.
You know, withdrawal, they call it detox, right?
Yeah.
I used to, again, this is where I feel like an idiot when it comes to this topic because solutions apart from cold turkey, I used to think in the old days being, I feel like that was a couple of years ago, you'd say, oh, just go cold turkey, just go cold turkey. And then I just think about, can you explain that? I mean, physiologically, the withdrawal symptoms, people need to understand that if you've ever been really addicted, and how many times have you seen it? If you're not handled appropriately during withdrawal, you can go into things like seizures. You can actually be hospitalized. In some people, it can actually, the withdrawal effect can cause death. Can you talk about this idea? I still think we're a society where cold turkey seems to be, yay, good for you, you quit it. And I'm going, I don't know about that anymore. I think unless people are surrounded by help, even medicinally, behaviorally, I don't know how they overcome a serious addiction.
Well, that's very true. And it depends on the drug and it depends on the degree of addiction and what
Yeah.
you're trying to withdraw from. But statistically, smoking is a good example. The most successful means over and over in studies of quitting tobacco is quitting cold turkey. And the same with sugar addiction. It's easier. People tell you all the time, they tell me they're trying to lose weight. It's easier for me, they say, to just stop eating all sweets than it is for me just to mitigate it. Just have a little bit, I'll cut down. I'll just have one here or there. Because the minute they have one, their brain kicks into that high gear again, the memory, and it wants more.
Yeah.
And so cold turkey, when you're going to be sober and in recovery, you have to be abstinent. And in abstinence, especially early abstinence, there is withdrawal. If it's heavy withdrawal, now most drugs, luckily, people don't need to be in the tank for withdrawal on heavy medication to allow them to physiologically survive it. Most people, if they're surrounded with a good enough milieu of people and support and caring and exercise and nutrition and sleep and so forth, maybe they need some medication to help them sleep, but they don't need to be medicated so they don't have seizures and things like that. But if somebody's in heroin or they're into really bad alcohol addiction where they're really drinking a lot of volume, then they do need to be medicated in withdrawal so that physiologically they're at least safe. But the key thing you said is support, friendship, connection, people around you that can help you succeed and know you can succeed. People don't want to be alone, and they've rarely reached out for help, and they really need help. That's why the AA programs and the sponsor programs, you've always got help. It's a connection, because connection is what helps you through it.
Do interventions still work? And so if people watching this want to do an intervention with somebody, I mean, do you give any sort of simplistic advice? Do they talk to their doctor who might be a specialist? Because an intervention, is played on TV all the time in comedies and drama. And I don't, how does someone even go about that if they want to intercede or intervene that way? Do you have any tips for conducting or an intervention?
I do. Interventions are hard. For some people, it's the only way you can do it. And everybody has tried the other methods. And we talk about interventions. It's not black and white. It's grayscale. You can go one-on-one, put your arm around them, have a little intervention just with a quiet conversation. And if that doesn't do it, sometimes it's a little bit more. And I do. Some people, sometimes they bring people in here saying, talk to the doctor, see if he's got a solution for you, because they don't want to take the heat for being the intervener.
Yeah.
So they let me do it. So if you're going to do an intervention, if somebody is really down that path where you've tried everything else and they really need to have a come to Jesus meeting, so to speak, in that kind of an intervention that's really serious, it needs to be professionally done. It needs to be thought out. It needs to be planned. It needs to be rehearsed. Everybody needs to be a part of it. The trouble with intervention that is not done well is it can blow up in your face and you'll be worse off than you ever were before. Because don't do it well. In a really well done intervention, I'll tell you the reason why they work. I told you that the addict is totally devoid of their feeling state, right? And their biggest assumption is that if you really knew what was going on in my head and how crazy my thoughts are and what I'm doing to handle those thoughts and how self-destructive I am, you would judge me, you'd reject me, and you'd get me out of your life. You'd think I was nuts. And I would never think that you would really understand me. And I really believe that I'm unlovable. I don't love myself. I don't believe you can love me. So when they're surrounded, and they think also it's the secret that nobody knows. And we say it's kiddingly, we say it's the secret that everybody knows. Everybody sees their behavior, but they think they're hiding it from everybody, right? They keep this person away from that person. They control everything in their life. So their addiction is secret, they think. They don't realize that everybody's watching their choices of behaviors and inconsistencies and all that. So their assumption is that if everybody knew or anybody knew that I care about and love what I'm doing and what I'm thinking, that they would judge me and I'd be out of their life. And an intervention surrounds them with everybody in their life that's meaningful. Every very close, intimate friend is there. And not only do they know, but they love me in spite of it. And the thought that you see what I'm doing, you know I've hurt you, and you know what I've done to this person and that person, you know my behavior has caused all these problems, and you still love me, that thought is emotionally overpowering for people. And they go, wow. And they just break down and they go, gosh, I'm so sorry. If you'll love me, if you'll be with me, maybe I'll be able to risk it. Okay, I will. My way hasn't helped. I'm in bad pain and I need your help. I just never thought I could have it. And if you know my truth and you still love me, that's overwhelming for me. And it breaks down my emotional barrier and lets you inside that tent. And now we can hug and maybe go together and try again. That's the
No, it's incredible. But so what do you tell? Because we always, it's like in medicine, it's what the person's going through personally, and then there's all the people affected by that behavior. Where do you when you talk to some of these families and couples, where do they go just to get help, regardless if you're successful or not in your intervention or helping the person? If I was helping a friend and I was constantly involved, and there's a certain exhaustion with it, where would I go for help?
Yeah, it's a good point. And the reality, in the best of cases, they have family weeks. And the families, the addict goes to the recovery program. The family goes to the family program. And in the family program, it's sometimes because of insurance, it's changed now, but typically in a family program, the family goes through a sort of a condensed version of everything the addict's going through. They go it through for themselves. I'll tell you the truth. I'll tell you my own secret. You were vulnerable. I'll tell you my wife is in recovery. She's my star. She's been in recovery now for I think almost 40 years now. So I went through, and she went through the Betty Ford Center. Joe Persh, who started the program at Long Beach Naval Hospital, he's the one who treated Betty Ford, and then she went ahead and started her center based on his teachings. So I went to the Betty Ford Center for my wife. And what I learned at the Betty Ford Center was, what about me? What was my part in it? And what can I do to be most healthy? And the thing that we have to learn is that the thing that the family members can do that most helps and encourages the person that we're pointing it to as the addict, the thing I can do to help you the most is if I take care of me the most helpful way that I can about me. If I become the best me and I let you become the best you, I'm not trying to control you anymore. I'm not blaming you or judging you or shaming you or whatever. I'm just trying to be all I can be in love of you and try to be helpful for you. Then I'm allowing you to be who you are in my presence. And so in healthy recovery, family members look in the mirror themselves and go, what's my part in this? How could I show up in the most healthy way? How can I model and demonstrate healthy behavior when I'm stressed? And how can I help you when you're stressed? And together, maybe we can be more than either of us can be alone. So it stops the judgment and the blame. And the forgiveness is huge, because the resentment and the pain caused by addictive behavior in a family system, and it can be family, this can be a company, it can be a team, it's the group. But the resentment and the history of pain and maladaptive stuff is huge. And it's really hard to forget that. Well, people want to be right. You can be right or you can be successful. And here you have to choose to give up all hope for a better yesterday. Yesterday is gone. We can't change that. What we can do is we can pick up today, go forward here hand in hand, and be the best we can today in service of each other.
That's powerful stuff. I mean, it's I always they call it compassion fatigue sometimes, you know, in cancer and other places where I just think all the people that I had friends and other people who dealt with all sorts of issues, and I would watch the people taking care of them, and I would always kind of go, who's taking care of those people taking care of them? And so it's interesting that you say, so for people watching, when they're helping the person who needs help, they have to engage themselves to get help for themselves, right? I mean, that's basically what you're saying. If I'm probably not putting it adequately.
The second victim. The first victim is the one who has
Second
the
victim.
problem. The second person. But remember, we're in this disease, we're all victims. Nobody's
Yeah.
trying to screw anybody. Nobody wakes up and say, you know, I'm going to screw your life up today. Nobody wants to be a bad actor. Everybody just wants to be loved. We all just want to be worthy. We want to feel good about ourselves. We want to be loved. And we want to be useful. And nobody intends to have it progress to this thing. Based on your point, there's groups, you know, there's Alcohol Anonymous groups for alcoholics. There's Family Anonymous groups for families. There's all kinds of support groups. There's Al-Anon for the person that's the family member of the person that has the narcotic problem. And here's what happens in addiction. People go into group therapy, you know, and you see these TV things and they make jokes about it. But
Yeah.
my thought is, if I'm the addict, that nobody could ever understand me because my thoughts are crazy. My behavior is crazy. I'm in terrible pain. I'm very alone. Nobody's ever felt just like I feel. And if you knew, you'd judge me. They get into a room all of a sudden, and everybody in that room has felt exactly like they felt. And their eyes just go, holy cow, I thought I was alone. And to know that they're not alone and other people have the same thing, then they think, well, you know, maybe it isn't my fault then. Because their theory is, their assumption is it's my fault. I'm a bad person. And the reality is it's got nothing to do with that. It has to do with when genetics meets opportunity, and then the rest is just going to go on autopilot. And when they realize that there's a whole group of people and a nation of people who have felt that way, who have accepted help, who've beat this thing, and they never get over it, it's never cured. It's just we control it. And knee-jerk reaction may always be what it was going to run away from my feelings, but the healthy person has the knee-jerk reaction, but stops a minute, takes a breath, has mindfulness, and decides, okay, I have that feeling, but now what am I going to do with that feeling that is healthy and productive instead of self-destructive behavior that I've done before? And when I don't feel like I can do it by myself, when I'm afraid, who's on my team? Who can I call to ask me to go through it with me?
Well, I think a lot of people watching this will think, okay, wow, he went through the physiology, he went through the impact on family, he went through treatment options. And then I just think of one more question to answer. I don't know this is a loaded question. I think a lot of people will talk to someone who's gone to some of these centers that cost a lot of money. And I understand some of them cost a lot of money. So what do you tell people who are worried about just the expense of it in this day and age? Just paying the basics. I mean, how do you even deal with that? I know it's a big question that probably takes an hour to answer, but how do you talk financial?
We have to do that conversation all the time, right? Because everybody has to deal with that. And it is expensive in those really nice recovery programs. And there's a difference, to be fair, between really good, healthy recovery programs and fly-by-night programs that promise you that you're special. You know, every addict would like to, we would call it terminal uniqueness. I'm special. I'm not like all those other addicts. I tell people when they go in there, I answer it in another way, but I tell them, don't look for the differences, because everybody wants to see that I'm not like that person. I didn't do that. I didn't lose that. I didn't kill anybody. I didn't hurt. I didn't have a 502, whatever. Don't look for the differences. Look for the sameness. Everybody in that room that's been through this has something of value to give to you if you're humble enough to receive it. Everybody has a message for you. Everybody can be the Buddha in the room. Everybody can be your Buddha or your teacher if you're humble enough to put your ego on the shelf and say, what can I learn from this person? Because our feeling state, the names, the places, the details change, but the feelings and the need of feelings all the same. Great programs are wonderful programs that give great support, great education, great family programs, but there's lots of roads to Rome. The majority, take alcoholism, the great majority of people who got sober and are healthy in recovery did it through AA, not through a program. So you don't have to go to a fancy program. You just have to want to show up. You know, it's nice to be able to go to a program. That's the, I think, the most comprehensive way to do it. But there are outpatient programs. There's intensive outpatient programs, IOPs, they call them, that are very helpful. There are AA groups. A lot of people get sober just by going to the group. They go to a group meeting every day. They go to AA meetings every day, sometimes twice a day. People will volunteer to help them. They'll come over to their house. They'll take them to meetings. They'll offer them something to do, food, clothing, and shelter. It's amazing what groups of people who are all suffering want to offer somebody else who's a fellow traveler. And
Yeah.
so you have to have the money to go to a big program. If you do, hooray for you. But if you don't let that be the reason why you're still self-defeating your behavior. You can get help if you want it just by showing up and doing what you can do and asking for help.
So yeah, so that's interesting. Sometimes cost is not the issue. I mean, sometimes it's just a matter of figuring out the resources. I mean,
Sometimes
not only
cost,
financial resources, but
sometimes cost is in the way. If people, a lot of people with a lot of money, I'm Gucci. I'll go to Malibu and I'll have a really Gucci program there, and they'll give me massages and treat me special. What they need to do is stop thinking they're special. They need to learn that they're not unique. They're not terminally unique. They're not better than anybody else. Their feelings and their need and their pain is the same as yours. And what they need is to learn to take that. That's what Joe Persh found out. You could take your officer label off, Captain John's, and you can be Bill and just be who you are. And that's where healing starts. Just taking your ego aside and just the truth about who you are as a human being, not as some role you play or how you want to be treated by other people or how you want other people to see you.
This was going to be my last slide, so to speak, my last sign, but this is for when the next time we meet, because I like to go through at least some of these individually in terms of their impact and in terms of some treatments, and we can cover some of these. So for example, notice which one I put at the top. Whether it's in cancer, whether it's, these are very traumatic situations, and the problems with alcohol are just stunning. And then there's subtle addiction and there's overt addiction, right? So I want to make sure that I'm not going to just let people know to stay tuned next time. We're going to go through some of these because, for example, some of these are used as medications. For example, some people with cancer will use marijuana for a variety of reasons. But, so doctors aren't as concerned depending on the situation. But then there's the person who gets overexposed and then it runs into havoc. So there's so much subtleties with some of these different compounds that I want to make sure we cover that next time. But I was so excited to talk to you about alcohol to start with today, but I don't think we're going to have the time just because it's just unbelievable the awareness in my life over the past 10 years, how easy it is to get exposed to these. What I've noticed, and this is set up for the next time, I don't know if you've noticed, is that there's just sort of this game going on where the concentration of the component is increased. I don't care if it's caffeine, I don't care if it's tobacco and vaping, some of these alcohols, the concentration gets more and more. And I think about, for example, marijuana. When I was a kid, you're looking at THC levels, a couple percentile. Now, 20, 30, 40%. That has completely changed the addiction game, hasn't it? Because they've concentrated these addictive compounds. And that's like ultra processed foods.
Well,
You're concentrating you're concentrating the idea of going after the dopamine quickly. Is that a way to tease it out?
Yeah. I mean, if you look at the good example is marijuana. In the 60s, when marijuana was really introduced with the military veterans coming back from Vietnam, many of them smoking marijuana, the THC content of marijuana was 1%, the average. And when people started to use it, usually by joint, by smoking, sometimes they used pipes, but usually it was smoking. And they would have to smoke several cigarettes, several tokes to get high, to feel anything. Are you feeling it yet? Are you feeling it yet? And it wouldn't. Now, the average concentration is not 1%. It's like 14 to 15%. It's been found as high as 25%.
Okay.
And that's like 1,000 times more concentrated. And now just one puff will get you high. The concentration is way more strong, way more serious. And like you're saying, with vaping and everything else, if a little is good, everybody's thought a lot is better. And so everything has gotten more and more and more and more. We want that quick hit.
We do want that quick hit, and that
Finish
concentration.
on this. It's all about balance. I have a friend who said, he wrote a book called Health is a Question of Balance. And he told me, he said, he was studying wellness around the country, around the world. I said, what do you think true wellness is really about? He said, I think true wellness is nothing more than balance, perspective, and appreciation of life.
Mm.
I think that's everything we're talking about. It all comes back to balance and attitude, kind of.
Mm.
You can do anything, a good thing you can take to extreme. A lot of people who are addicts for alcohol or cocaine, they become exercise addicts when they get out. And unless they run their 6 miles today, their life is ruined. So anything, even a good thing, taken to the extreme can become out of balance and dysfunctional. So I think in sum, this all ought to be really about balance and perspective and understanding yourself as it is and appreciation for who you are and having ability to forgive yourself for not being perfect and joining the communion of saints who all want to be better with each other.
Oh, it's a perfect way to end it. I really appreciate this time. I mean, I just was staring at each slide and reading it and listening. And so, I mean, like I said, I apologize. We're probably 10 years overdue, but at least we did it. And I'll see you for the part 2. But before you go, I wanted to make sure to say thank you sincerely. It makes me think of all the people that I, in friends and my inner circle. So anyway, to shake that off for a second, because it gets very deep, I thought I would give you, at least the PCRI would give you a gift that no one's ever given you before. And you can choose between one of the two or both. So can we bring up the gift that Dr. Rice will be sent in the next week to his office? But there it is. He used to be the team doctor of the San Diego Chargers. So I thought you'd want this cup now to support the Los Angeles Chargers. But if you don't want that cup, I have a better cup for you. Can we bring up the second cup that he can keep if he wants to? There you go. How about that? That's the Jim Harbaugh Los Angeles Chargers cup.
I think you keep both those cups.
Yeah, you got no, wrong answer, Dr. Rice. Wrong answer. The right answer is you keep them both.
You know, I don't know. I don't know if you saw the draft. I probably shouldn't say this. Rolf Benirschke was asked. He was a kicker for the Chargers in the San Diego days, and he was asked to announce the draft pick this year's draft for the San Diego Chargers. And he's supposed to say, and this year's pick for the Los Angeles Chargers is. He wouldn't do that. He said, this year's pick for the Chargers is.
Oh,
So
it still runs deep.
the people that were from San Diego and in San Diego, it still runs deep.
Sorry, man. And Harbaugh had nothing to do with that. He just went where the team was. But so you can't blame him.
Okay, I grew up in LA. I'm a Rams fan.
All right, I'm going to let you go. I know you have to see patients. You're probably running over. I will see you for part 2 when we'll collect. We're going to go over this. We're going to go individually over some of these different things. And then we'll collect the top questions in general that deal with addiction, from how, when, where, what to do, that come from the audience all around the world. And then we'll meet up again just for that Q&A. Thank you. Namaste. Thank you, my good sir.
I got you. Okay. Pleasure. A pleasure.
Pleasure.